Hey Ken, thanks for hopping on the call. Pleasure to be
Yeah.
chatting to you. Some conversation I've been looking forward to having for the past week and a half, ever since we first got in touch a few months ago. And
Mhm.
I'd love to hear a bit more about what you do, and you can introduce yourself for anybody that's listening.
Oh, well, I'm a physician assistant in the United States, physician associate. Actually, we just changed our name. I'm a clinical specialist in men's health. I've been doing this work now for 29 years this month, um, with probably 26 of those years specifically focused on the men's health space. And I have a background in general medicine and general surgery, actually, and then also in research. So I'm naturally curious, and early on in my career, I just recognized that there was a real issue with the health of men. Statistically, long before even I was practicing, men were not doing very well. The life expectancy for men, although it's improved over the years, has not progressed like we would like it to, and the difference between men and women for his life expectancy has actually widened over the years. And so I look at it as a health disparity, and there certainly are a number of factors that contribute to that. But men are lacking and lagging behind in terms of their overall health, and it's a global problem. It's not a U.S. problem. It's happening everywhere, and so. Um, One of the things I thought was important was figure out a way to bring men's health to the forefront of men's minds, if you will. One of the things that we talk about in the U.S. healthcare system in particular is that our system is not designed for men to remain engaged in the healthcare system for any real length of time. What I mean by that is, as a young child, your parents pretty much drive your healthcare. They are taking you to the doctor, doing your regular checkups. In the U.S., it's required to have immunizations, to go to school, etc. And then once a young man reaches the age of 18, unless they go to college or they have employment, join the military, perhaps play sports, where their health care at that point is mandated, our system really does not even drive them to remain engaged in the system and to do preventive health care. And as a result, we see that men are more likely and more inclined to suffer from chronic illness more than women. And very few men, even from some sociological standpoint, don't even want to engage with healthcare because they feel like it's a sense of weakness, if you will.
Mm.
And so, I really felt challenged that we needed to do something different about how we approach this. And so I've kind of carried that torch since I started, and really trying to make a difference there. The gaps that I found was when I was in school, and sadly, even today, very few of my colleagues and physicians alike, it's been studied and researched and written about, get very little training in this space. How the health conditions that are common affect men, and how they affect men, culturally, how they affect men. Um, it just are things that we just don't get much training on, and 29 years later, I'm still learning, but most of it's on the job training. So,
Yeah,
um, and so as a result, moving forward, as you see on my chest, gynecology,
great name.
started training. Thank you. Started training my colleagues, and helping them, rise to the occasion of helping improve the health of men. Um, there are a lot of inherent challenges, as I mentioned. There's very little training in that. So, in the scope of just trying to do your job every day and try to learn all this very complex stuff, and how to be creative and innovative in how you deliver this care, it's a challenge to say the least. And so, um, gynecology for us is to develop and was to develop this centralized place where my colleagues could learn more about how to take care of men, what things they should recognize, how to um, depending on where you work. So, for example, if you work in urology, like I do, how do you associate the comorbid conditions and that are again, for example, erectile dysfunction, very closely associated with heart disease? How do you get that patient when you see them, who has, who's young and fits sort of this criteria for where they may have underlying heart disease and EDs being their presenting symptom? How do you get them to cardiology? How do you communicate to their general practitioner? What sort of things can you do in working them up to make the handoff seamless to make sure this patient is taken care of? And so that, along with educating the patient that these are not trivial problems, and that it's more than your manhood. It's your it's your life that may be at
Yeah,
jeopardy when these things happen. And so, and it's not a scare tactic, but it's just really important to get that message out there, on both ends, both for the patient at large. And so, starting this year, what we're going to do is although we spent the last 5 years focusing on our colleagues and training the healthcare providers, this year we're gonna start educating our if you will consumers, which is the patients that we take care of. Because you know I often joke with my colleagues. A lot of us work in practices that they're like airports. We keep building airports without runways. There's nowhere for anybody to land, right? So, and I said, so we need to let people know that there are airports, and then that bridge is that runway, if you will, for them to have a place to land where they can get good education and information. And that's our next venture with gynecology. So I like to have some fun with it. You see my T-shirt. I have learned the value of the conversation.
yeah.
I think I shared with you in the past. I said that it's funny. I can put this T-shirt on and I'll walk through. I'll be traveling. I'm in an airport, and I've literally held up the line of people getting on the airplane, because either
You're a
somebody
flight
sitting
risk.
asks me, or the flight attendant's like, "Wait a minute, you're not moving one step further till you tell
Yeah,
me about that." And
there's a
so
guy.
we'll.
There's a guy holding up the plane talking about penises.
Right, right. So, and I'm like, so it's been great, and I early on didn't recognize the value of that. I thought, well, this was selfishly was like a catchy way for us to kind of, change things, if you will, kind of make it digestible, men's health, right? A little, and but it turned out that the fact that somebody sees that and they look at it and they go, "Hey, tell me about that," and I realized what I started doing was I was having people have conversations that they just weren't ever having, and without that, nothing gets going, right? So that was a lot of fun, and it's been great. And it just really said, boy, maybe we need to take this one step further, beyond the interactions I have one on one with patients. So, um,
Love that. There's so much you touched on there, and just trying to figure out where to start. Well, that's a consistent theme that I hear. So there's two consistent themes that I hear when I'm talking to medical professionals about their businesses and stuff every day, and one of them, namely, being one thing you touched on, which is, especially consider we focus specifically mainly on men's health and mental health businesses. It generally isn't the men 9 times out of 10, as far as I understand it. That's bringing them.
mm,
It's the girlfriend or the partner or whatever. They say, listen, my Johnny or Luke or Sam or whatever. I've been trying to get him to take care of himself for months, and the symptoms are starting to show. Be it mental health or physical health, and they're obviously correlated
mhm.
at a fundamental level. Um, but it's always reactive, and that's the thing that I'm hearing with you as well. It's those two things. It's namely not the lads that are they're being dragged over usually to take care of themselves because they don't appear weak, and secondly, it's that lack of a centralized focal point in terms of, as you said, if somebody has ED, it's symptoms. It's not the core issue usually. It's a lot of these different things. They just express themselves, um, and you're fighting an uphill battle then. So it's
Right.
interesting to hear that being such a core concept, uh, in terms of your approach.
Yeah, no, I mean, you're spot on. I'll give you a good example. I'm notorious for this statement. So diabetic men, for example, I think I've shared this with you before, but for the
I
those
know.
are
I can't wait
large.
for you.
I have these guys that come in, they're diabetic and they have erectile dysfunction, right? And in 85% of men who have erectile dysfunction is some sort of vascular problem. And most men who have diabetes are going to have vascular disease. And it's interesting, we're all taught that we need to look at circulation, peripheral circulation, like make sure they've got hair on their toes and they've got good blood flow to their lower extremities and, check their eyes and all these things. And like, there's these blood vessels halfway between your feet and your head that you probably should pay attention to if they're not working well. And I'll tell guys that. I said, how are you doing with your control of your blood sugars? You're diabetic. And they'll say, oh, it's okay. And I said, what's okay? And I said, what's your hemoglobin A1C? And I'll get one of two answers. Either I'll get a number that's just too high, or they'll say, what's a hemoglobin A1C? And which is even a more bigger red flag, and I'll tell them, I said, you do know this is why you have erectile dysfunction. And they'll look at me like, what? And I said, yeah. I said, I go, it's real simple. I said, if your sugar goes up, your penis goes down. I said, now I don't have to ask you which direction you want those to go. And the guys usually like, really? And I said, yeah. I go, you didn't realize those two went hand in hand. And they're just like, well, tell me more about that. And it's amazing how many men, when we connect those two things, I said, this is, they're like, nobody ever told me that. And I said, that's just crazy to me. But the real punchline in all this, by the way, is not that part, not about the punchline is that before they've had this conversation with me about their erections, somebody told them they could have a heart attack, a stroke, could go blind, lose a limb. And I'm like, but, they care about their erections. And I'm like, you know what? I said, I go, whatever motivates you to do the right thing, I don't care.
Yeah,
And I learned over the years that's pretty motivational, and it's
yeah,
amazing how many guys will all of a sudden go, well, I probably should take care of this now, and I'm like, yeah, well, fortunately you do have all your limbs, you can see straight still, and I'm glad you
yeah,
got getting this under control. So I tell them all the time, I said, you guys, you got to protect the original penis pump. I go, the one that's in your chest. It's just it's extremely important. I said, you want to go out and fix it. And I will say the good news, bad news about Viagra and all of the things that we have to treat erectile dysfunction is that oftentimes guys come in and we plug into what guys want. They want fixes, right? That's what we do as men. We want to fix things, right? So if you got something to fix me, then that's awesome. But again, I've shared this with you before. I said, I'm tired of fixing broke things. I said, I would like to stop things from being broken.
mm,
And I said, that's kind of where I've shifted my focus now is to get away from all having this tool bag of fixes.
yeah,
And so
yeah.
I'd
Duct
love to,
tape.
yeah, I'd love to put myself out of business. I say it all the time. I think it'd be
Yeah,
great. So,
yeah.
um,
It's a funny one that fundamentally at the end of the day is what gets, is the needle mover, pun feet unintended. But it's effectively Pavlovian conditioning. It's the stick
right,
hasn't worked. You'll get a heart attack, you'll die, whatever. Sometimes, I mean, if the carrot is what gets them to actually move the needle, then
right.
then so be it. But it's funny, I suppose. At the end of the day, fundamentally, we're irrational beings. So we can't be thinking logically all the time. Because that's an interesting one. As I understand it, you can correct me if I'm wrong here, Ken. Viagra, the intention, it was originally to help with circulation, and then as far as I understand it, the erection thing was basically a byproduct that they noticed, and they're like, make a lot of money, and then
Yeah,
erectile dysfunction was
yeah.
actually created after Viagra. The term was
So
coined. Is that correct?
that is correct. So, prior to erectile dysfunction being a term, impotence was the term that was used. And then, yes, this happy accident, happened at Pfizer. But, and I say it was a happy accident because it was a game changer, right? It brought, a lot to light, um, normalized the conversation, right? About
Mm,
erectile dysfunction, which was extremely important. Um, you know, like everything though, became a business, right? Again, more fixes, right? Came
yeah.
along, But it was an interesting thing. I mean, I'll share with you my journey with that. I will never forget. It was 1998 when Viagra came out. And I remember the first time, I heard about it. I remember when it got approved. I believe it was March of '98 to be exact. And I was probably about 6 months into giving it out, and I noticed who was coming in. Like I never equated the two. It was my
Mm,
diabetic, my guys with high cholesterol, like my guys with high blood pressure. They were all coming in with this erectile dysfunction, and I was like, huh, I didn't think anything about it. And I used to give this talk, and I had this patient. His name was Randy, and I jokingly said that was my aha moment. I call it the Randy phenomenon. Um, because he was diabetic, overweight, and he had ED. Obviously, everybody was hearing about Viagra, and he's like, hey, can I get some of that Viagra? At that point, we had a closet full of samples. I said, sure, I'll give it to you. And it's about a few months into taking it, and he was taking it a lot. He'd had a new lease on life. So everything was going great for him and his wife,
yeah.
and about 3 months into it, he says, hey doc, he goes, I just wanted to tell you, he says, I'm doing pretty good. He says, I've noticed lately I can feel my feet a lot better. And I said, really? I said, well, that's interesting. I said, that's nice, Randy. He said, see you next time. It's like, yeah.
On that note.
And I said, so, but then then a couple other people were talking about how like, oh, my hands feel better, and I was like, huh, and so it
Yeah,
made me delve into, well, how does this drug even work? What is it
yeah.
working on?
Here's
Which you
the
might
knowledge.
think like, why are you prescribing this to people if you don't know that? And I said,
Yeah.
I didn't, but we,
Vasodilator.
yeah,
Yeah.
yeah, but the issue is most people who have vascular disease, they have damage to the lining of their blood vessels, which is essential to the blood vessel's ability to dilate. And
Mm,
so people with high blood pressure, high cholesterol, diabetes, abnormal blood sugars, their blood vessels can't respond very well to normal stimulation for vasodilation, we call that. And
right.
so, which is one of the things, again, that would evolve later on, is we realize that a man who's not responsive to Viagra, Cialis, Levitra, the drugs,
Yeah.
that they have worsening underlying vascular disease that absolutely is at a critical juncture, which requires more intervention on our part, more evaluation. So it taught us a ton. Um,
Right. Right.
kind of going back to its roots almost, like why did they have
Yeah.
it out in the first place? So it was great, like I said, it was a happy accident. And but I mean, it's funny. I mean, it took us a while to catch up. I mean, it really did. Like,
Yeah. Yeah.
so,
It's interesting that I suppose for anyone listening or watching this, again, just to explain, obviously vasodilation just means the opening of the blood vessels. And
hmm
as far as I understand, based on what you were saying, um, generally Viagra, which was originally created to compensate for this, it does that. It compensates for it. But if it's the case that's not effective, it, as I understand, based on what you just said, it's usually indicative of the fact that the inner lining of the blood vessels is that bad or unhealthy
yeah,
that we really need to get a deeper look at the actual fundamental issue as to why they're having circulatory problems in the first place. That be
right.
fair, sir?
That is correct. Yeah, and I'll tell guys all the time. I said, if you're taking one of these medications and they stop working, is I said, they'll say, oh, the pill doesn't work. And I says, no, the pill works fine. It never changed. I said, you are no longer responding. Something's
Right.
changed with you that we need to delve into. And that's just another way of saying what you just said. But that's again, one of those things that I try to communicate to these patients is that, these medications are only as good as the bodies they're working on.
Hmm.
Right. So if you're not healthy enough to respond, then that's an indicator that there's something more that we need to do in terms of evaluating what's going on with you. Um,
Right.
in my sick way, I will tell you, I say it that way. I'm making fun of myself. There used to be this Viagra commercial where this guy and this woman were older and kind of looking serious, and then they start talking about Viagra on the commercial, and the next thing you know, they're
Yeah.
all dressed up and they're at this ball and they're dancing and stuff, And
Yeah.
I told them, I said, if I had my way, if I could redo that commercial instead of looking at them all happy with talking about Viagra and what's going to happen after they're done with the dance, I would have the guy clutch his chest and fall to the floor. I said would be a better commercial in my mind.
Right.
I said, just in case you didn't know, I said, if you have ED, this is a much more serious problem. I go, this could end tragically, not the way you think.
Right.
That's kind of mean, kind of a little too, it's probably a bit much to say the least, but
But as I
yeah,
understand, effectively, you're just saying ED is generally a symptom of the underlying issue, not the core issue itself.
correct.
Um, right. And then based on what you're saying there, so there's so much we can kind of go here because as far as I understand it, it seems again, this is I'm not a practitioner, but as I understand it, it's nearly like a hormonal equivalent, or you know, it's kind of nearly not hormonal, but basically it's a similar concept to say is it Wolff's law? Basically, the stress you put in the system, the body will reply, react accordingly. I know that works with bones, but effectively, it's
Hmm.
use it or lose it. In the same way, if
Right.
somebody hops on TRT and their testes stop producing testosterone, then all of a sudden, when they need to up the dosage, it's usually indicative that the body's just said, "Listen, I don't even need to have this function anymore," and
Right.
it snowballs. Would that be a fair statement, or
Yeah,
I
yeah.
think right there?
What you're touching on is a element of a very complex thing.
Yeah, yeah,
It
yeah,
as I meant, a lot of factors in that.
yeah. Yeah.
That change over time, change over disease progression, etc. I mean, there's a lot that happens there.
Mm,
So you describe a scenario, yes,
yeah.
that would be accurate. You touched on something else too. So I'll again, I always hear that if you don't use it, you lose it. It's funny how people take that statement. They think about that like, well, if I don't have sex, then my penis won't work, you
It'll fall
know.
off. Yeah.
And so I've changed that up. I said, I told at the time, I said, don't tell me if you don't use it, you lose it. But I said it's important for you to have erections. So to your point, men are meant to have regular erections. You wake up with them in the morning, you have them during the night while you're sleeping. What does that do? From a nature's perspective, it makes sure that the penis is ready to, again, be able to engage in sexual activity to make more human beings. That's what it's for. If like any part of your body, if it's not getting its regular exercise, then it tends to not function well, right? So that's another part of this. And so I just tell guys, I said, if you don't get one, you won't get some. I said that's probably a better way of putting it. It's just,
You get that.
um,
That could be the back of your gynecology t-shirt moving forward.
right?
Stop more flights.
You know, I joke the folks I work with, they're always saying they have my isms they put up all the time. That was one of them. I said, yeah, I go, that's you need to have erection. I don't get to use them all, but I said, man, you better be having them regularly. So you have got to practice if you're going to play this game. That's plain and simple.
Yeah,
So,
it's like we said, you're saying you played ball in college, like you had to go train. uh,
so,
um,
um,
so with that being said, obviously a lot of what you're talking about here is, again, there's general. I said it's a very nuanced, complex topic. I suppose I want to circle back. What is the 80/20? I suppose the 20% of activities will get the 80% of results in terms of lifestyle factors that you commonly see men maybe getting wrong before they get to the stage where they need a reactive solution. What are preventative measures that someone can take from a lifestyle standpoint to improve their health within the confines of sexual health?
yeah, I can tell you, man, I can point to a lot of things, but I probably high on my list is diet. High on my list. People have to eat better. Um, we live in a world of eating too much processed food, not enough fresh fruits and vegetables. Whether I look like it or not, I'm an old man. But fortunately, and I say fortunately, I grew up um, grandson of farmers, I have loved fresh food my entire life and find processed food to taste terrible. Um, so I'd say that's a big one. Exercise, of course, right up there. I mean, these are things that people don't want to hear, right? Like they're just like,
Mm,
I don't want to eat right. I don't want to exercise. I don't want to do those
yeah.
things, I told you, I said, I shared this with my patients. I said, the guy comes in and he's really, really overweight. And I said, look, I go, I understand. I said, gaining weight is fun. I mean, the food is awesome. You never, you're tired, but you're not tired from working out. I said, it's great. I go, you're never sore. I said, it's amazing. It's a good time. The drink is great. I mean, all of it's awesome. I said, but I said, it's like something you've done for a long time. And I think another barrier to that is that, nobody gains weight overnight. Everybody wants to lose it overnight though, right? I mean,
Mm,
so um, the less fun journey when you're not getting to eat what you want all the time and all these things, and not being active, I think is a big part of that. The other thing too might be some misconceptions about yeah, we already mentioned about erectile dysfunction. When a person's not eating right, exercising, doing things like that, there's some things you can't help. Genetics obviously plays a role in some of the things that people get, but the things that you can prevent by just taking better care of yourself um, don't get addressed, I think, enough. So then when somebody does get to the point, let's say they don't do these things and they do come in and they do have high cholesterol, they do have hypertension, they are diabetic and they are uncontrolled, looking for things to fix them as opposed to them participating and fixing themselves, I think is where it gets challenging for folks. So I think 80% of it, in my opinion, really is that, and trying to take care of decades of behavior, just letting them know the things that do matter. There's nothing wrong. And I think it's great. You mentioned dangling the carrot. If a guy says, man, I hate it, that my sex life is terrible, and I can tell them, like, you know what, we can do some things to make that better. I go, and I tell them, I said, pills, we have injections, we have all these different things. And I said, that's your short-term fix. I want you to work towards a long-term solution. Right.
right.
So I said, so I'm okay with saying, if you're healthy enough to take a Viagra and get it, and you can have intercourse and you're doing good, like I want you to work towards being able to still do that, but without the need for the Viagra. That's
Right.
we would like to see really across the board. I know we probably don't have time for this call, but I could tell you, I mean, like the pandemic was,
I'm good for time. The
okay,
next person in mind say,
so the pandemic, I thought was a really interesting thing. I gave a talk to some of my colleagues about um, what we learned early on was the men were getting infected at the same rate as women, but men were dying more more likely to die from COVID, right? So we were
we're
like going,
stubborn.
but we're back to this same problem. Why? Because we talk about the vascular problem. Well, it's a sign we call inflammatory disease or metabolic syndrome and these things. What comes with that is a hyperactive immune system. This virus caused person to have an over the top immune response. Men were in this inflammatory state. They got infected. They were more likely to have this over the top immune response. And you heard a lot of people dying from strokes and things like that because of their immune response. So people who had those problems were more likely to die from COVID infection. And unfortunately, most of the population, men are more likely to have that condition.
Mm,
So that's what we saw. And so I talked about that. I also talked about the impact on mental health. Men don't do well in isolation
no.
compared to women.
Why is that,
And so
do you think?
men really require a lot of physical connection. I think that's part of it. I'm no psychiatrist. This is just me reading about it. But I think men in isolation. I joked. I said, Anybody who's seen the movie The Shining should know men should not be left alone for any length of time in isolation because this is what happens. But on a serious note, it did. Men became very disconnected. You saw them having to face things that, without the isolation, they weren't facing. And now they found themselves forced to be isolated and to face some things. And it was tough. They had no coping mechanisms. And so, we saw more mental health anxiety. We saw more depression. We saw more suicide. I mean, all these things were happening. And the irony for me when I gave this talk was I said, it's funny. This pandemic happened in 2020. I said, I find that ironic. That's a number that we equate with clear vision. And I said, we should have seen this clearly coming.
Mm,
This is what was going to happen. And so there's just so much to be learned. And I think even I was extrapolating with no proof, but I had made the comment as I was recognizing who was getting sick and who was dying from COVID, particularly in the male population. I said, we're going to see some people who might have inflammatory disease progress faster than they did if once they've been infected, or we're going to see people who might have been in a pre-inflammatory state. We may see them turn up with erectile dysfunction. We may see them become diabetic. You're hearing things like long COVID and all that. Um, and I do believe that that's what we're seeing because it is causing metabolic disease in some people. And circling back to what I said, if we would do better about diet, exercise, things like that, and get ourselves out of this inflammatory state, you're more likely to do better to resist. You know,
right.
the,
So,
so,
as I understand it, based on what you're saying, the I mean, there's obviously this massive correlation between mental health and physical health as well, because obviously
mhm,
cortisol causes doesn't help the inflammatory state.
right,
Um, when you're talking about this projected increase in all these different things, because before we wrap up, I'd love to talk about the actual gynecology mission and how you plan on addressing this. But you're saying you predict all these increases. Is that due to the mental health side of things, or is it just because an actual physical chain reaction that you reckon COVID or similar things have caused? Or
yeah,
how do you see that interplay playing out?
great question. It's both. I tell guys no matter, if a guy presents to me as had ED for months, years. I mean, and let's face it. I mean, again, guys don't like to go to the doctor. Generally, have to be some sort of, imminent pressure, that breaking point that makes them come in. That being said, I tell the guys, even if I give you a Viagra or, anything I give you, and if we surgically help you, to be sexually active again, there's going to be a mental aspect to that. You've gone from I can't do anything to now I can do something, or I'm not sure if I can do something. um Sexually, there's a lot of that performance anxiety. I mean, things like that that come
Mm,
with that, right? So there's always an interplay there. I tell guys this because I said, they'll say, is it in my head? I go, it's always in your head.
mm,
It's like a knee injury to an athlete. They can get surgery done, right? But they don't really come back fully until they're mentally say like, okay, I'm confident that knee is stable and I can play like I used to play.
yeah,
This is very, very similar in that respect.
yeah,
Um, and again, as you mentioned, just the stress of the pandemic and not knowing what was going to happen. I mean, the whole world was on fire, right?
hmm
Um, and that was very scary to a lot of people. And those are the physical manifestations. So it certainly one always has an impact on the other. And I would venture to say that, and not inappropriately, we were so focused on the physical that we kind of lagged behind on addressing the mental.
yeah, yeah. And they usually go hand out. A very good friend of mine, Robbie Cassidy, he often talks about this whole cycle. He's a physiotherapist,
Uh-huh.
and but his whole principle is taking a holistic grassroots approach to everything. And he talks a lot about this whole psychosomatic, correlation, and a massive correlation that he points out that he says a lot of people don't address, and you've obviously touched on, is a lot of people come to him with back pain, for example, and inevitably, when the first thing he says is, I'm sure you'd have no issue with me sharing this. How's your, work going, or how's your lifestyle
Yeah,
going? And if you're frankly, if something was a chronic actual physical ailment, it wouldn't be coming up at the same time, every afternoon or just when you're in work. It'd be there all the time. And it's
yeah,
obviously your body's put in this fight or flight situation as the inflammation goes up, and you're naturally more reactive to these these different ailments, chronic back pain or whatever. And as you said, 9 times out of 10, it's all in your head. It's treating your body and just getting used to, hey, listen, it's safe. You're in a safe place here.
yep.
Because yeah, I mean, I'm preaching to the choir, but it's fascinating hearing that everyone at the top of the game, coming to the exact same conclusions.
Yeah,
Um,
there's a study that I quote all the time called the vicious circle of ED.
right, okay,
That was done by a guy. It was really interesting. It says like a guy says he has ED, then he's worried about his ED, which makes his ED worse. Then we treat his
yeah,
ED, and then they're like, okay, I got treatment for my ED. Now it circles back to I got ED. Every time I take a pill, I'm reminded I have ED,
right,
and you just spin, and it really is the reason. Like I said, is like why do we have to start talking about this more? Like if that you have that stress could be another underlying cause. There's no doubt. And if guy's having something going on and is distracted or whatever,
mm,
it's going to be tough. And I'll share with you one more thing about that. One of the most brilliant things I've ever seen was this doctor in New York, Dr. Shabsik used to, I think it was him that I saw do. He asked everybody in the audience, he says, show of hands, tell me when the last time you had sex, do you remember what you were thinking about when you had sex? And so all these people raised their hand, right? And he says, make sure I said that right. How many of you had good sex? Raise your hand. And they were, a bunch of people raised their hand. And he said, all right, how many of you don't remember what you were thinking the last time you had good sex? They raised their hand. He goes, you were the ones who had good sex because you were in the moment. You weren't thinking
you're actually
about
present.
anything else, right?
Yeah,
So,
yeah,
and I go, ooh, I said, that's good.
yeah,
I said,
yeah,
what I said, what an attention getter. I was like, I said, they're gonna listen to
yeah.
everything
You're
you
baiting
say from
people.
here on out.
Yeah, yeah. I can't get distracted, otherwise I'm not present.
Right.
Um, Yeah, it's interesting on this whole meta level. Obviously, that's a commonality you see in every area of life. Effectively focus on the now, focus on the present. It's just interesting seeing all these ancient bits of wisdom. We could get into that whole thing with religion and all that, and prayer effectively being grounding yourself in the present and all that kind of thing.
Mhm.
It's interesting. Everything, as you said, is going full circle. Um, the last thing I wanted to really bring up though, Ken, is we're talking a lot about systemic challenges and stuff that we're encountering here. We've touched on the sexual health side of things. I know you cover a lot of different areas of mental health.
Yeah.
What's the solution that you're looking to kickstart with gynecology, and the what's the mission?
Yeah. So like I said, what we want to do is we want to empower men. And it's, and when I say empower them, help them know more about how to take care of themselves, and not like you see. And I'm not bashing the places that say you need to exercise and eat right. We got the diet for you. We got the pill for you, anything like that. Um, I believe that empowering them must help them understand why you are where you are. And if we can do that, I believe, you know, all creatures on planet Earth have the capacity to learn. If we can teach them that, then, male or female, then they will more likely do better, if you will. They will work on understanding what they need to do to be healthy and stay healthy, um, and those who take care of them. We also want to empower them as well, so that whether they be clinicians or their significant others, um, it's a known fact. Married men live longer than those who are not married. There's a
Yeah,
reason for that. Women are very good at preventive care. They do it way better than we'll ever do it. You and I both won't live long enough for men to catch up on preventive services,
yeah, yeah.
even if we shifted the way we thought. So
We're
that's
stubborn.
really, so for us with gynecology, that was our big thing. And like I said, for the last 5 years, we've really focused on um, looking at the people taking care of them. and realizing that, we're missing the boat. And like I said, the conversations, that was what I realized was like, I don't know how many guys, I exchange phone numbers or, and they'll, or text message back to me like, hey, thanks for the conversation. I went to my doc. I found out these things. So I'm going to work on these things now because now I know. And, sadly, that's not happening in our world right now. People are busy.
Yeah,
Physicians are busy. PAs, nurse practitioners are busy. We're doing our best with the number of people that we have to take care of, but we just need to have good information out there. So teaching the people to take care of them, clinicians, but also helping the patients themselves be smarter and understand better what's going on with them. And then the last
perfect.
thing we're doing as a solution is how do we get here in the first place? And so research is our next thing. So hopefully anybody who's watching this, we are currently seeking funding for a research project that we're calling HELP, which is the Health Education Literacy Project. And what we want to do is um, take and educate young men starting at the age of 14, where we created a phone app and we'll give them some content and we'll do it year over year. And we actually do these little surveys to test them that they've learned. And each year we do age appropriate. We have 6 pillars of real health. The idea is that we're hoping that, once they reach the age of 18 and they leave, that where I told you is a pivotal time, that we will continue to follow them to see if what we did in terms of educating them has an impact on their healthcare decision making that's different than what we observe right now.
I love that.
Uh,
I
Yeah.
love that.
So yeah. So that's what we're hoping. And we'll do some things to make them compete against one another and stuff like that.
Gamify
And
it. Yeah,
yeah.
yeah.
So
Love that. If so, yeah, you're addressing at the root, preventative instead of trying to react and play catch up later and address the symptoms. Lastly, before I ask you where they can find you, if you had one sentence, just one single bit of advice from all your wisdom, from everything over your several decades helping men with their health, what's one bit of advice if someone came to you and they were maybe they're at that age 18 or maybe early 20s, any age really, what's the one bit thing that you would recommend that they listen to? What's the one bit of
man, that
advice?
that's winner for
Distilled.
you. Nobody's ever asked me that question, right? So I'm gonna have to shoot from the hip on this one. I guess I was asked one time, what would I say to my younger self? I said my younger self, sans my playing sports and things like that. I said I would know more about how to make sure I stay healthy for my own health, for the health and well-being of my family, um, and for my community, at large. And I don't mean just the one I live in, planet Earth. Um, and I'm sincerely telling you that I think that's what's important more than anything else. Healthy humans make this a better place.
Yeah,
It just does. We'll we'll thrive in ways we don't even know we can thrive in if we could just do
yeah,
that.
yeah.
And so if that's my one sense. I guess that would be. I don't know if that's one sense or not, but
No, that counts. Put your own life jacket on first, so you can be empowered to help others.
uh,
Yeah,
so.
love that. Brilliant. Where can people find you, Ken?
Well,
In
you can,
gynecology.
yeah. So I always tell people stay tuned. Website in development, but we're at www.learngynecology.org. Is one way you can find it. If you want to reach out to me directly, you can email me at kmitchell with 2 L's at learngynecology.org.
Perfect. Yeah, so everyone get on it and start taking care of your health. Or if you're a practitioner, learn how to help others.